Hello, my name is Tochnik. So good to be with you this morning. We're here today with Cullen Linn, Senior Interoperability Architect for Northern Arizona Healthcare and one of the first clients to begin using CommonWell services. Cullen has been overseeing the implementation of CommonWell services over the last 4 months at Northern Arizona Healthcare, and they've already had some positive results that we're going to be speaking about today. Cullen, welcome to the show.
Good morning. Thanks, Tom.
It's good to have you. Thanks for stopping by. All right, lead us off and tell us a little about Northern Arizona Healthcare and why you've chosen to leverage CommonWell.
Sure. Northern Arizona Healthcare is the largest healthcare provider in Northern Arizona. We serve not only a large geographic area, but also a dispersed and diverse population here. So there's a lot of need to be able to share effectively. Add on top of that, we've got a really large seasonal population. So we've got folks that come up to hit the slopes. We've also got folks that come up here to escape the heat of the valley. That really makes it important for us to be able to collaborate and share effectively, not just with providers in our community, but beyond our community. And as we looked at different technologies and ways to accomplish that, CommonWell appealed to us because of the National Record Locator Service, so that ability to reach out beyond our community. What we found was that it actually brings a lot of value transparently in other areas as well. So we're continuing to expand our use of CommonWell.
So tell us more about your CommonWell experience so far at Northern Arizona Healthcare.
Sure. It's exciting. We're still refining a lot of things, but what we've determined is the value is pretty transparent overall. We've experimented with different roles across the spectrum. So we've looked at schedulers, medical assistants, nurse care managers for follow-up care. And what we've got is pretty general positive feedback across the board. There are still improvements to be made in the service and in the EMRs, but it's a huge step forward in letting us work with all the folks we need to work with. We weren't sure what to expect back from the patients, but it was kind of the first time for us really engaging them in interoperability. But what we found is most patients assumed that we were already doing something like this. And as we went to enroll them and explain the process, we found we were getting closer to their expectations of what healthcare should be. Even when we log into CommonWell, we don't find information, we explain that to the patients. They really appreciate the transparency, and we kind of set it up for the next time around. The clinical staff has really appreciated the fact that we've got that additional support to provide information about the patient. They get that updated information, and in the way that it's built in our EMRs specifically, there's a reconcile process where they can bring that into the EMR, and it's not that far removed from their typical workflow, so they appreciate it. Kind of eases them into the change. From a technical standpoint, it was kind of a no-brainer with a couple of the EMRs we worked with. It was a flip of the switch and it turned it on. With some of our more complex providers, it was less than a couple of months to set it up. So there are still ongoing issues we're working out with everything. But this close partnership with all the vendors, we've really been able to experiment and find the right workflow and the right technology for each thing.
Got it.
We were one of the first sites, so we didn't know what to expect. It hasn't been perfect, but we've achieved a lot of value in a short period of time, and we're still planning on expanding further.
Outstanding. So what makes CommonWell so cool for you and your organization? You mentioned clinical staff. How has it been received by clinicians so far?
Yeah, so generally very positive. There are two main things that the providers appreciate. The first is that, again, the way it's been implemented, at least within our EMRs, is it's in their workflow. They don't go somewhere else to get the information. They're in their current EMR, in their workflow, not logging off to another portal. And that's something that's always appreciated. It allows them to do their job more effectively. The second kind of benefit is that the expansion of the CommonWell network is completely transparent to us. We don't have to go through a special effort to get more information from more providers. So as our providers log in and look at the information from patients, they're seeing new information from new providers. And that's just kind of a bonus as they work with this.
Got it. So what have you learned from the experience so far that will help other providers as CommonWell continues to deploy services nationwide?
We've learned a lot of lessons so far, a lot of great things. I guess a few to start off with is that we didn't know what to expect, so we began piloting. We experimented with different workflows. And we weren't sure how it was going to impact them. But what we learned was no matter where we seemed to implement this, whether it was with a scheduler or a follow-up person or the medical assistant, the workflow was pretty consistent, and it was fairly transparent to them as well. So it was easier than we thought. And in terms of time, we thought, is this going to be a big impact to them? And it turned out not to be. I mean, we're on par with just a few minutes into each workflow, which is definitely acceptable for the value that we're bringing. The second big learning really for us was not every provider has the same needs. So we went in thinking, hey, we can turn this on and everybody's going to be happy with what they're getting. But what we found is by specialty or by hospital area, providers are looking for slightly different things. So we started off with the transition of care summary and found out there's a lot of value there for primary care providers, but some of the specialists don't see value there as much. So what we learned was we had to kind of find out what does matter to you in your specialty or your area. And we found that we could add those documents. We could begin to share new things through CommonWell. And that ability to expand out that infrastructure was a big benefit for us. So the lesson, I guess, would be learn what the folks want and really kind of tailor it to their needs.
Got it.
And the last thing is that it's not going to fix everything. So we set expectations appropriately. Healthcare is a big space with a lot of opportunity, and this is a huge step forward in one of them, and that's information sharing.
Absolutely. So, well, Cullen, we're about out of time. Before I let you go, how can people contact you should they have any questions?
Sure, folks can feel free to reach out directly to me. I'm cullen.linn@nahealth.com.
All right. Cullen Linn, Senior Interoperability Architect for Northern Arizona Healthcare. Great to have you. Thanks for joining us.
Thank you. Take care.